Do, 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 do. Do, 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 do.
Hi, welcome to Vitamin Junkies. I'm Jennifer Lyle.
I'm Dr. JJ.
And we're addicted to good health. Today we're going to be talking about some natural remedies for erectile dysfunction.
Mm-hmm.
But before we get into that, we're going to see what Dr. JJ is taking today.
Okay, today I'm taking one of my favorite herbal products. I'm taking Ginkgo Biloba. I've talked about this a few times. I take this for memory. I also take this for stress management because it helps manage the blood flow between your brain and your adrenal glands. And a neat little beneficial effect is that it improves your erection. It actually helps you sustain a longer erection, and it's a treatment for erectile dysfunction, which is a nice little bonus. Which as a man we never say no to. So Ginkgo Biloba, I'm just taking one. If tonight goes well, I may take 4.
I did have some ginkgo tea this morning, so what will that do for me?
Maybe save the tea bag for your husband.
So JJ, can you explain what is erectile dysfunction?
Okay, so erectile dysfunction is a dysfunction in the erection of the male penis. Okay, this could happen in 3 forms. So either the man cannot get it up, so he cannot get an erection. He could get it up and he can't sustain it, so you'll get hard and then it'll eventually go soft. Or premature ejaculation.
What causes it?
Okay, there's a number of causes. There could be trauma. So say, for example, if someone's in a car accident or someone's had a spinal injury. So basically there'd be damage. Damage to the lower back, damage to the perineal areas. That's the area around your groin. So say, for example, if you've had a fall and you've landed there, or riding your bicycle too hard, there could be some erectile dysfunction problems. Medication, there's a number of medication that will actually interfere with the ability for you to get hard. So antidepressants, blood pressure medication, there's a lot of problems there. Certain diseases, high blood pressure, diabetes. Very commonly we find men who have trouble with getting an erection and diabetes. Certain mental states, depression, anxiety, chronic stress. A lot of people are chronically stressed. They just can't get it up. And also more other mental emotional stuff. There may be some trouble with the couple. There could be an argument going on. Also maybe the husband's not as interested in his wife or his girlfriend anymore, and that's kind of manifesting in the physical form. Also, there could be some sexual orientation issues too. So there's a number of things. It's multifactorial. It's not usually just one thing. It's usually a bunch of things. So.
Now, what can you do about it? Are there some natural approaches? You mentioned ginkgo. Are there others?
Yeah. So ginkgo is a great one. Usually I start with Ginkgo Biloba. Fish oils, because the nature of the erection is that blood floods into the penis to get it to become hard. I like to make sure people have good blood circulation, so I usually put them on a fish oil. So fish oils are very good for blood circulation. Probably the best herb we have for erectile dysfunction, if ginkgo doesn't work, is a herb called yohimbe. It comes from Africa. It's a wood that comes from a tree in Africa, and it reportedly works quite well. At least that's the feedback I get from patients. If that doesn't work, then we try acupuncture. Not on the penis, so don't be afraid. And that actually works really well. So we've done that on a number of men. We've done some acupuncture. Counseling, because in some cases the nature of it could be related to relationship issues. Yes. So maybe some couples counseling or some one-on-one counseling and see what's going on. And if that doesn't happen, because having a healthy sex life is very important, then the men will go on medication, so Viagra or Cialis. And what we do is, because these drugs have some side effects on the heart, we just manage this. So we just make sure that they know how to take the medication, not to abuse it, and we do some heart protection treatment. So.
Is this something that's typically long-term, or is it short-term?
It depends. It depends on the cause. If you have a spinal cord injury, well, then it's likely long-term. If it's mental emotional, then it's probably short-term. It's something you have to work through.
Oh, very good.
Yeah. It's common. I see people have it. It goes in, it happens, it doesn't happen, and so on. So, yeah.
Oh, interesting.
Yeah.
So it sounds like you really need to work with a healthcare practitioner to help you through these issues and find out the path that's right for you based on where the issues coming from.
Definitely, yeah. So you see, it's multifactorial. So yeah, most definitely.
So if you'd like to find a naturopathic doctor like Dr. JJ in your community, you can click on the Find a Practitioner link on our website, vitaminjunkies.com. And while you're there, don't forget to join the addiction, where you can get a subscription to our weekly podcasts.
And while you're there, we want to know what topics you want covered on our show. Please complete our viewer survey, and you could win a chance to get $100 in free cool stuff from Hey Jute.
Awesome. Thank you so much for joining us today. I'm Jennifer Lyle.
I'm Dr. JJ.
And continue the addiction to good health.
Do, 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 do.